Welcome, aspirants. Let's get straight to it. I'm your faculty for today, and we're unpacking something absolutely paramount for your GS Paper 2 Social Justice syllabus. We're decoding the paradox of progress in India's healthcare system. Let's dive right into the data and the sharp analysis you're going to need to secure those top marks.
And I'm joining Sir today to help you tackle this from every analytical angle. Now, just imagine you're sitting right there in front of the UPSC interview board, and the panel hits you with this question. Has the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana truly solved our healthcare access crisis? You know, it's so tempting to just nod and list out the scheme's achievements, but as future administrators, you've got to look way beyond the surface.
Absolutely right, ma'am. And to look beyond the surface, you need hard, credible data. Listen carefully. For your mains answers, you must strictly quote this exact source, the 80th NSO Household Social Consumption Health Survey. It's an absolute goldmine because it's literally the very first comprehensive post-pandemic health data we have since PMJAY attained maturity. This right here is your foundational evidence.
So, let's acknowledge the positive strides first, right? Since PMJAY launched back in 2018, insurance coverage in India has expanded by around 3 times, a 3x increase. It's taking up a much larger share of healthcare financing in hospitals now. Honestly, it's a massive administrative achievement, and you should definitely highlight this right away in your introductions. But here's the catch, and this is your critical analytical paradox for GS Paper 2. You see, there's a stark reality on the ground. Merely possessing an insurance card doesn't automatically guarantee you a hospital bed. Despite this 3x wider nominal coverage, our actual hospitalization rate hasn't even recovered to 2014 levels. Why? Because those hidden diagnostic costs and extra ancillary charges are still severely limiting real access for the poor. The card is there, but the barrier remains. Spot on. Furthermore, we really have to decode the epidemiological shift happening across India right now. The proportion of our population reporting as ailing has actually doubled. And we're seeing a significant drop in infectious diseases, but a rapid spike in non-communicable and chronic diseases. Now, economists don't necessarily interpret this doubling as India just getting sicker. Actually, it's a positive sign that more people are finally becoming visible to the healthcare sector and actively seeking the care they need. And when they do seek that care, we have to examine the out-of-pocket expenditure, or OOP. There's a fascinating dichotomy here that you absolutely must include in your analysis. The mean, or average OOP, has roughly doubled, but the median OOP has dropped to 11,285 rupees per hospitalization, and it's practically zero for public outpatient care. So what's the takeaway? It means our public primary care has successfully absorbed those basic costs, but severe, chronic surgeries, they're still inflicting massive financial deprivation. Aspirants, grab your pens because I want you to note down this exact quote for your mains copy. State-funded health insurance is subsidizing private healthcare providers' access to low-income markets without also enforcing regulated prices. This is absolutely crucial. Because PMJAY reimbursement rates often fall below market rates, private hospitals just compensate by billing the patient separately. It completely exposes a systemic flaw where the state is essentially opening up low-income markets to the private sector, but without the strict price enforcement needed to protect the patients. Building right on that point, let's look at the public infrastructure side of the equation. The data points out a huge gap in the Ayushman Arogya Mandar, or AAM, network. Yes, it provides free medicines and diagnostics, but it remains significantly underfunded when you compare it to the heavy needs of managing chronic diseases. And because of this massive gap in the public sector, the private sector steps in, dominates chronic care, and drives up those catastrophic costs ma'am just highlighted. Okay, so how do we conclude our answers to get those top marks? Here is your definitive mains blueprint. First, always acknowledge the public primary care has done a fantastic job shielding many seekers from poverty. Second, you have to address the catastrophic costs that are now increasingly hitting the nominally insured middle class. And finally, the ultimate way forward. India absolutely must strengthen its public sector hospital capacity so it can fiercely compete with the private sector for tertiary care. That is the key. We're going to leave you with this final, provocative essay prompt to really ponder. How must India balance this private healthcare dominance with an underfunded public network to achieve genuine universal health coverage? Think deeply about it and write out a practice answer using the NSO data we just decoded. Keep studying hard, keep that analytical edge sharp, and we'll see you in the next explainer from Rungta IAS Academy.